Andrew is a writer, lawyer, and entrepreneur, and most notably, he's the founder and CEO of Moby Clinic, which is an innovative health tech initiative seeking to improve last-mile health service delivery in his home district, about 60 kilometers east of Kampala in Uganda. He was the winner of the 2019 Sandoz Healthcare Access Challenge and represented Uganda at the Entrepreneurship World Cup. He is passionate about reinventing access to healthcare through a fusion of physical and digital resources and innovations, and he's here today to talk with us about his Moby Clinic. So thank you, Andrew, for being here today.
Thank you, Hayley, for the invitation.
Sure. So just to get into some questions, I know people are going to be really excited to hear about this. I was wondering if you could just provide a bit of background on the state of healthcare access in Uganda, specifically as it relates to reproductive health services.
All right. The state of healthcare in Uganda, I would say, has improved over the years, but it's not anything close to good.
Right.
We have two segments of populations. That is the people who are based in urban areas and those who are in the rural areas. Now, the majority of the people, 8 out of every 10 Ugandans live in rural areas and low-income communities. And these are the people now who struggle most with access to healthcare. And the government framework, the existing government framework, is that these areas have health centers. However, for instance, in my home district, there are about 2 to 3 health centers, and you find one health center servicing about 200,000 people. And that's a big number. So you find also these health centers are very far from the people. And when one is sick, imagine when you're sick and you have to walk over an average of 12 kilometers to access the near health center. And so there is the problem of distance. And further to that, these areas have few health workers.
Right.
So it's a whole cocktail of issues that are contributing to the problem. And why they have few health workers is because of socioeconomic factors.
Right.
These people cannot afford paying doctors handsomely. And that's why you see the few existing doctors prefer to work in the city and in the small towns, in the urban areas. And so the rural areas and the low-income communities are very marginalized when it comes to access to healthcare because of the socio-economic factors. And you find the rest of the few doctors actually travel abroad for greener pastures.
That's great. Thank you so much for that little bit of explanation. I think kind of across the board, it's a challenge of lack of healthcare access in in rural areas. And like the need for innovative solutions is very, very present. So in that context, I was wondering if you could tell me a little bit about Moby Clinic and kind of what you do there.
All right. So with Moby Clinic, I began to think of Moby Clinic when I traversed a number of countries in sub-Saharan Africa about 3 years ago. And I saw that this problem of accessing healthcare is across. It's an African problem, and it exists in rural areas, but also low-income communities, which you may sometimes find in the towns, and people cannot also access the doctors because they don't have the money. See that the biggest question on table, the question at hand is, with our few doctors, how do we ensure services reaching everyone? Because that's already a challenge. Right. How do we use the available resources to ensure services have reached? And that's when I began to think of the Moby Clinic model. That gave me the determination to come and start it off, to pilot it at home. And at Moby, what we believe that in order to achieve health equity, first of all, we need to reimagine, rethink, and reinvent our health systems, especially in the global south, in this developing world where we have few doctors and few health workers. And so how can we do this? This is what we respond, that number one, just 2 things. Number one, empower community health systems. What we do is empowering community health systems. And how is this done? Simply by onboarding willing volunteers and existing village health teams to be given the skill set to become respondents in the communities. And so these are trained to become what we call CHPs, community health providers. And so our vision, our plan is that for every 100 people, that is for about 50 households, we onboard one community health provider. Somebody who lives within the community, okay, and who is known also by the rest of the members of the community, such that if that pregnant woman in the rural village needs assistance, they will not have to worry about many kilometers, but they know there is a first respondent within a walkable distance, such that if somebody suffers a stroke, there is someone who will be at their first respondent's help. Okay. And why is this important? I will also give you an example because it relates to a personal experience.
Yeah, please.
About 6 years ago, almost the 2014, in July, my grandmother suffered a stroke late in the night and in the wee hours of the night. And the people who ran to her rescue, none of them had knowledge on the first responders, on the first aid. And then the people did not know the numbers of health centers, let alone the fact that the health centers are many kilometers away. And so it's accessibility. It was the main issue that was making her fail to get medical assistance in time. And so she was kept for hours till the next morning when she was transferred to the city. And that's because for her, she's lucky enough to have family members to get her from such an area to the capital city. But however, because of the late response, it was a lost battle. And within a number of days, she died. Now, that is not only a story of my grandmother, it's a story of so many people across those areas. So because healthcare has not been made affordable and accessible, what people do is they do self-medication with the local herbs. When the women are pregnant, they go to what we call TBAs, traditional birth attendants. And these are people who have never attended any form of training, but they simply try it out. It's all about gambling. Today it works, tomorrow it doesn't.
Right.
And that becomes very risky. So it is little wonder that in Uganda, actually, every day over 25 women die while giving birth. And much of the statistics come from such areas. Now, secondly, we go to the gist of the matter, is we created an application called the Moby Clinic app. Now, once we have our skilled community health providers, and they are in these communities, we very well know that the training of these people is to a certain limit. They are first respondents. So the communities they live in, time to time, they will face situations or conditions that are beyond their scope of training. And now this is what makes us very different from all organizations in community health.
Right.
For us, we created we are the first proponents and innovators of what we call a digital safety net. And our theory of change is leveraging this digital safety net to revolutionize or ease last-mile health delivery and access in rural areas and low-income communities in Africa. And how does the digital safety net work? With the digital safety net, like I mentioned earlier, that the community health provider is simply trained to a certain limit. Now, when Hayley turns up, the patient called Hayley, for instance, turns up, and they have a condition that is beyond the training of the individual, the CHP. The CHPs will simply utilize our application to consult or to seek guidance from senior medics.
Right.
Okay? And this is what we call the digital safety net. It's just it ensures that services being given are safe and everything is happened within the frame that one has to operate. So we believe that this digital safety net is the best way we can utilize the few doctors and create a synergy of the few doctors together with the empowered community health providers. And we believe that once you do that, first of all, you're going to be able to help the doctors to become less overwhelmed and the health centers to become less overwhelmed because diseases will be detected early, okay, by these first responders. And what you will find at the end of the day, the doctor-to-patient ratio is improved. It reduces. Fewer people are waiting for the doctors, okay, because the basic ailments are being treated in the communities, okay, and why this is important, it is because if these diseases and ailments are not detected early, often at times they graduate into more complicated situations, thus high mortalities in this area. So they should be effort in significantly kicking off the basic ailments and early detection of diseases. Then also, it offers what we call integrated referral. It lists the near health centers. For instance, if it's a district, it lists the near health centers in that given district. So a community health provider, and what this does, it improves the efficiency of a community health provider, because now they are aware that, oh my God, I'm stuck with Hayley. I have tried to treat them with this. It's not helping. They get an application. They can consult senior medics. If that fails, again, our app offers a number of options. Again, they can get to know what contact to call, okay, of what health center, okay, and this eases referral process. And then the third one, our application also onboards numbers of ambulances in the area, in the district, and also for emergency responses. So you realize with these three things, integrated referral, emergency response, and the digital safety net, these things make community health workers 100% effective and efficient.
Right. Yeah. Wow, that's incredible. There's so much to unpack there. I think in many ways it's fascinating to me that you're using this technology, but also community health partnerships, and realizing the importance of like having those two work together. And at the same time, obviously Uganda has an issue with doctor-patient ratios, and so taking these things as given, and realizing that, you know, of course there's advocates doing work to improve that in that realm, but in the meantime, there's this huge unmet need, and especially in rural communities. And so this coordinated healthcare system of like really localizing healthcare, I think is important too. I would like to ask if you spoke a little bit to this, but if you find that the ability to go to people in local communities rather than going to healthcare centers, and assuming commute time aside, do you think that people are just more inclined to seek out healthcare when it's in their own communities for other reasons, because they feel safer, because their families know whoever the person is running the clinic? Does that also have an impact on healthcare outcomes, do you think?
Yes. So when it comes to the question of it all goes down to the question of access. What these people feel is that these centers are very far from them.
Right.
Some of farmers, you find a pregnant woman, she's a farmer, she has 5 babies to look after also. And when she feels if she has to travel 12 kilometers, a lot of her things are going to paralyze within that time. Yet also service at the health center is not that good, and yet it also requires a lot of money. And so they feel a bit frustrated, and they're like, no, these are decentralized. If healthcare is decentralized, and it's put into their communities, walkable distances, people are actually craving for that, and that's what they want. Yeah.
And kind of you've spoken again a little bit to this in terms of like pregnant women, but at the moment, just from online, it looks like MobiKlinic has 2 main programs, those being a maternal health care program and a program that's focused on distributing cyanopress, which, for those who don't know, is an injectable contraceptive that provides about like 13 weeks of protection. And I was wondering if you could tell me a little bit about why you chose these programs to start with in particular, and a bit about how they're administered. So why prioritize these 2 programs to start MobiKlinic?
All right. When we come to these two programs, you realize that with MobiKlinic, we end up building a network of community health workers, health centers, and so this network can be leveraged, okay? It can be leveraged in different ways. It can be leveraged for programs, or also to distribute health products, or also for research. And you realize it's a one resource that can be used in a multidimensional way. And now this is we got these programs because the partnerships we some of the early partnerships we got had a bias for these areas, and which also is because when we have an organization that comes and says for us we are looking for sexual reproductive health, and so we want MobiKlinic, the model, the network to offer a program that we welcome, because we take on as many programs as possible. And then also when we find those with maternal health, yes, it's welcome. We also, that means we make a refresher course for our community health providers, equip them further in that area, and they are good to go. So, but again, these two programs are very important. When you look at the one of family planning, Sayana Press, many times these people in these areas, they never get a chance to family planning options. Okay, the family planning, the knowledge on family planning, the options and the access to tools, to devices for family planning have been left as a privilege largely for the people, for the elites, and also the people in the middle income and the rich people. So the people this side have not been helped, and that's where you can find one woman giving birth to even 15 children. You find also children starting to give birth as early as 13. And it all comes back to one thing. Once health access has been denied to people, all forms of health access have been denied, even the sexual reproductive health. It's that's why I say that once health access becomes improved through now like MobiKlinic, you find that it unlocks all forms of health access, because now this program was looking at teaching women about the self-injectables and having those willing to take them up, and it was amazing. There was a significant number of women that took them up, and up to now take them up. And the question is, if you remove the scenario is, if now you remove MobiKlinic from the picture, these people are not going to have that access. You realize that the main thing is coming down to access. Once access is there, all forms of healthcare will be realized. Also, it's the same for maternal health. These women are going to traditional birth attendants because that's what that's what is available to them. That's what is within their walkable distance. And not that because they're not scared that they have seen others dying in the hands of TBAs, but looks like it's what life has availed to them. It's what they have no other alternative. So once you come giving them a safer healthcare, one that is with accessible and affordable, trust me, they are willing to also. In fact, they also crave the modern healthcare. Okay, but just because that efforts have not been channeled to that area to make it accessible and affordable for them, and so we feel this is what MobiKlinic is doing. On the maternal health program, the response was overwhelming. Like I said, much more than. Because this was supported by the United States Embassy here in Kampala. This program for 9 months, it ended in September. But unfortunately, we had to also turn some mothers away because the size of the grant is too small to enable all this to be done, So again, it goes back to the problem we are solving is a complex one, and it shall necessitate us to have more resources. However, again, this here is food for thought. Like I mentioned earlier, there is a lot of billions of dollars that get thrown annually in global healthcare and access. However, I feel it's not effective. Okay, because for us, the clinic, we simply need $1 to improve access for one person. That's how we in our previous programs, how we have seen it. Now, in Uganda, we have 35 million people facing these problems. For us as MobiKlinic, if we got $1 million, we can be able to improve access once and for all for 1 million people. Okay. And if we got 35 million people, then that $35 million, then that means we can improve access for the 35 million people, and that's once and for all. Yet, we receive, yet healthcare in Uganda from donor aid receives hundreds and hundreds of $1 million year in and year out. So we feel we offer more what we call development per dollar, more development per dollar than any other existing alternative that is working with healthcare.
Yeah, saying that kind of what you said has two things for me, and the one is that you bring up an interesting point about how donor dollars and development aid isn't always used in the most maybe effective ways in terms of healthcare, and the gap, and this offers the thought that organizations like MobiKlinic and technology-based companies have the opportunity to fill that gap in a more efficient way, I think is a really promising idea. And the perfect. And that's interesting to me because it speaks to this idea of sustainability too, right? If development programs come in from external actors and implement temporary healthcare solutions, those aren't long-term, right? And so it seems like MobiKlinic is sort of saying, okay, like this is good, but ultimately we need a localized solution for a very local problem that local communities are going to trust, are going to use. And like you said, like it's not like MobiKlinic goes in and establishes a whole new program. You base it off of what's already there in the community, what strengths are already there, what gaps are there, and sort of leverage those so that MobiKlinic can be kind of as effective and efficient as possible. And that's really interesting. And so it seems like MobiKlinic has a lot going on and a lot of visions for growth. And I'm wondering what you see as being sort of the long-term goal or vision for MobiKlinic. So I don't know how many, 10, 20, 30 years from now would you see MobiKlinic being?
So our potential partners are the development agencies, the governments, and also technology, any technology that our 10 years down the road, I look at MobiKlinic as a company that is going to be, to have eased access for more than 2 million people. I look at us over a decade or two becoming Africa's most revered last mile health delivery company. Our one solution, it solves the entire cocktail of problems. So I do have a lot of faith in it. I do believe our solution is easy to replicate. Because our growth plan in new markets, we simply will be franchising digital solutions, our digital tools that is work for the community health providers. So we believe because of the fact that we are cost effective, easy to scale and replicate, we have very minimal costs of establishing in new markets. That makes us better placed to scale to different countries that need a sort of our model. We are pushing and we have a lot of hope in what we are going to be able to achieve. And at the end of the day, we are working day and night towards revolutionizing the last mile health delivery in Africa and being a homegrown solution for a home problem. And it's not just Africa, but also other developing nations that can benefit of our model.
That's incredible. Thank you so much. It's been really interesting to hear you speak about these, like I said, these local solutions having technological problems. And I think that we spend so much time when we think about technological innovation, thinking about these super advanced, futuristic urban settings. And we forget that like base level, locally integrated technologies just need to be disseminated everywhere in rural settings and everything like that. And that is probably where we will see the most change and the most benefits of technology to the greatest number of people, as opposed to, continuing to develop technological hubs in very specific areas of very specific countries. And forgetting that, the real human applications of this for things like basic access to healthcare are so vast and untapped. And so the fact that that's something MobiKlinic is taking on is really admirable and exciting, I think, for the development community.